Living on the West Coast, you've got the ocean, the mountains all in one frame. It gives me incredible access to all of the activities I enjoy outside of work, and I can't think of where else I'd like to be living right now.
I think the coast is a special place. It's a community where people genuinely look out for each other. It's a very safe place to raise kids where they can grow up with space, independence, and they're pretty strong connections. To me, rural health shouldn't be at the edge of the system, it should help define it. If we design care that works for small, remote communities, we create something stronger and more connected for everything. It's a huge geographical spread and a really diverse workforce who delivers all of that care. We've got Greymouth with Nīkau as the hub, Te Raukawa, a number of Northern Buller clinics, and then 5 small clinics that make up the southwestland area practice. The coast is a remote and isolated location. It would be 4.5 hours to get to Christchurch. There's pockets of the coast community who have missed out and have always missed out on healthcare, and you rub up against that, and I really think that gives you a bit of a purpose for why you're here and why you come to work. I'm one of those rare Australians who moved the other way, and I'd trained in rural medicine in Queensland, and I really wanted to work somewhere where it was similar. Rural generalism at its core is about general practice delivery, and it's then also about acute and urgent care, so particularly sort of emergency or some basic inpatient care. And then it's deliberately training skills attuned to community need and developing a broad workforce who can do it.
I'm a dual-trained rural hospital medicine specialist and general practitioner, including sexual health and gender-affirming care. One of the things I love is being able to provide care within an integrated rural generalist framework, not practice in silos, but bring aspects of primary care to where the patients need it. I have seen and diagnosed an ED, provided ongoing care on the inpatient ward, and then followed them up in primary care. Rural generalism for us isn't just a job title, but it's actually a workplace culture. We recognise that everyone comes from all different backgrounds, different experiences, and their contributions are valued and worthy.
I do procedural obstetrics here, and it's a deeply enjoyable part of my work. A number of us have gone to Christchurch to do an advanced diploma, which is the skills basically to provide intrapartum complex care, caesareans, assisted deliveries. And what it means is you take what's traditionally been a roster of 2 people doing the obstetric cover, and now there's about 5 to 6 of us who have the skills to cover that. So straight away you can see that's much more sustainable. It's really based around supporting midwifery staff as the core providers of care, which is, particularly in New Zealand, the real bedrock of the model.
I really enjoy living and working on the West Coast. Me and my husband Hamish live a 5-minute drive from the hospital. Hamish is a principal at a local primary school. We're able to enjoy work and then have plenty of time at the end and the start of the day to do things that we enjoy doing. One of my big hobbies is flying, and I have my private pilot's license. We have an aerodrome right outside the hospital, and it's really just enjoyable to be able to use my brain in a way that is completely non-clinical or completely unrelated to the work that I'm doing on a day-to-day basis. There's just no end to the scenery.
Moana Clinic is only 30 minutes away from Greymouth. In terms of supporting the rural nurses who work there, it's really key that we have medical practitioners, nurse practitioners who visit that clinic, and that's also to support the community so that they can have primary care services close to home. It's really important that they don't feel isolated in their practice.
As a rural nurse specialist, at times we see presentations that we aren't sure about, so we can easily phone through to Te Nīkau Greymouth Hospital and seek advice or assistance. That makes us feel like a part of the bigger, wider team, even though we are quite a wee way away from Greymouth.
I think it's vital actually that you really do understand what rurality means in whatever patch you're working. You've got to understand where people drive, what access to your facilities is like. Having worked across nearly all of the clinics at some stage in the entire area, as in the entire coast, has been really important, and I think is a really important part of both understanding how rural generalist medicine plays out, but also as Chief Medical Officer, what the conditions that your teams are working in. I do really like to get up to Westport at least once a month and meet with the teams there as much as I'm able. It's just a key asset for that community. They've fought hard for it over the years. It's really, in many ways, the ultimate example of rural generalism. It's got co-located general practice and then a small number of inpatient beds and an acute stabilisation unit where, as you can imagine, in a small community, anything and everything can arrive.
One of my passions is being able to teach and provide training for our rural hospital registrars. We also have fifth-year medical students placed with us for the year from the University of Otago, and so I'm involved with coordinating their runs and their learning with us. For many of our med students here, it's maybe their first exposure to a rural community and perhaps the beginnings of a career in rural health.
You want practitioners who have bought into and like the idea that they're part of a community, and I think you do that best in rural communities when you're as close to community-based care or primary care as you can be. In terms of co-located general practice in both Westport and Greymouth, it allows you to be a salaried medical practitioner and to work across the breadth of your skills, which is truly part of why I came here. I wanted a job where I could do both hospital work and general practice. It's just an incredibly rewarding way to practice medicine. You work across settings, you get to keep a really broad skill set, and you're part of a team that you do feel genuinely makes a difference every day. It's a career that's varied, meaningful, and genuinely needed. And that's really what rural generalism is. It gives you the chance to build real relationships, develop advanced skills, and shape care around a community.